So here I'm going to talk about Parkinson's disease and Alzheimer. Parkinson's disease, it is the disorder of the central nervous system that affect the movement and often including tremor. So the nerve cell damage in the brain and causes the dopamine level to drop on leading to the symptom of Parkinson disease. So Parkinson disease, easy way to remember, I said shortly called PD, P for Parkinson's, D for disease, and D for dopamine, D for decrease. So in Parkinson disease, dopamine level go down or lack of dopamine, right? So if I said this disease is caused by a depletion of what? Depletion of dopamine. Pathophysiology, the cause, some journals said it is unknown, may be linked to environment, head trauma. Patients sometimes give the history of head trauma, chronic antipsychotic use, or decrease the dopamine level. So what are the basic sign and symptom of this disease? Right? So they say the symptom gradually onset, tremor at the rest, rigidity, bradykinesia, shuffling gait, and pill rolling. So if I said what are the signs of Parkinson disease, you can answer me. Slow the movement, and this is called bradykinesia, or tremor in the hands. In this picture, you can see tremor in the hands and feet at the rest, muscle rigidity, or movement problem we call shuffling steps. Also, loss of balance, very common sign. This disease is slow progressive disease. The disease process is very slow. And who is affected most? Usually men affected more than female. But in case of multiple sclerosis, women affected more, right? In compared to the Alzheimer disease, Alzheimer, men and female equally affected in case of Alzheimer, but Parkinsonism is more in men. So here they said symptom. In this picture, we also see the muscle rigidity and slow movement, a stiffness of the hip and knee joint, Mark's face. Mark's face means emotionless, right? So here we see the picture where loss of the dopaminergic neuron in the substantia nigra. This is the area we call substantia nigra. And what are the diagnosis, treatment, and nursing intervention? Diagnosis is the patient give the history 2 out of 3 common symptoms, at least. Maybe rigidity, bradykinesia, tremor at the rest, right? So If our patient diagnosed with Parkinson's disease, what are the nursing intervention? First of all, assessment. So assess the neuro status and assess the swallowing abilities. Safety assessment is important also. Safety assessment with ambulation to prevent the fall. Encouraging the patient to take fluid intake, high calorie and fiber food, right? And also with a low protein diet. So I said the Parkinson's disease patient supposed to take low protein diet. So in case of CKD, chronic kidney disease, also need to take low protein diet, protein restricted. So treatment. So what are the medication we prescribed? We prescribe anti-Parkinsons or anticholinergics. So if your patient take anti-Parkinson or anticholinergics, what we educate them? When taking the anticholinergics, or the client should increase fiber and fluid to avoid the constipation. If patient take anticholinergic, patient develop some side effect of anticholinergic medication like blur of vision, dry mouth, photophobia, and tachycardia. So what they said, control the symptoms first and give them levodopa. It is called Sinemet. Levodopa use with some caution if patient has glaucoma, right? So it is good not to give. And also, what vitamin should be avoided in the diet, like vitamin B6 should avoid. Because why? Why B6 should be avoided? Right? Because B6, which blocks the medication effect. So also another question sometimes NCLEX board asks, if your patient took the dopamine replacement medication, what other kind of medication they should avoid? They should avoid monoamine oxide inhibitor. Because when the patient take dopamine replacement medication and monoamine oxide inhibitor, patient chance to develop hypertensive crisis. Also, we can give them amantadine, right? Or salicylene. So this is the very basic information we should know about the Parkinson's disease. And next one here, we're supposed to talk about Alzheimer. So Alzheimer disease, shortly called AA, right? What does it mean, AA? A for Alzheimer and A for acetylcholine. So in the Alzheimer disease, basically patient deficiency or lack of acetylcholine. Parkinson's disease, dopamine drop, depletion, decrease. But Alzheimer disease, it is acetylcholine deficiency. And common sign, dementia, means forgetfulness. So Alzheimer's disease, a progressive disease that destroy memory and other important mental function. So brain cell connected and the cell themselves degeneration and die. So in this picture, we can see this is the healthy brain, but this is the Alzheimer patient brain. The brain tissue get shrinkage, degenerative change occur, right? And brain cell die. And eventually, that destroy the memory and other important mental function. So if you ask me, what is the cause of Alzheimer's disease? So this is the normal brain showing, and here, this is the neuron, healthy neuron. But in Alzheimer's disease, we can see this neuron is called neurofibrillary triangles develop. The Alzheimer's disease is thought to be caused by abnormal buildup of protein in and around the brain cell. Abnormal protein buildup. This is the abnormal protein buildup. So one of the protein involved is called amyloid. So abnormal amyloid protein is built up in the brain. And this amyloid deposit of which form of plaque around the brain cell. And deposit of this we call triangles within the brain cell, and they causes the problem. So first of all, Alzheimer pathophysiology, the accurate cause is unknown, but decrease acetylcholine, A for Alzheimer, A for acetylcholine. Microscopic plaque found in the brain tissue, we called abnormal protein formation. It is called amyloid, and they deposit in a form of plaque around the brain cell. So who is affected? More than 65 to 85 years old, affect men and female equally. Our most important priority, prevent the fall, prevent injuries, right? So now question. Parkinson's disease is more common in men, but myasthenia gravis or multiple sclerosis more common in female. But Alzheimer's disease and Guillain-Barré syndrome, it is equal, men and female equally affected, right? The common symptom, gradually loss of cognitive function, right? Or also movement problem, or they cannot perform purposeful movement, and forgetfulness is most common, right? So in part Alzheimer, memory loss. So Alzheimer is a type of dementia that affects the memory and also thinking and behavioral change occur. The symptom is eventually grow severe enough to interfere with their daily activities, right? So here I said our main priority to prevent injuries, prevent fall. And I told you Alzheimer's disease is a dementia, is a major problem. So what are the difference between dementia and Alzheimer? So dementia is a general term for a decline the mental ability, right? And severe enough to interfere with daily life. So Alzheimer is the most common cause of dementia. Or I said Alzheimer is a specific disease where the dementia is most common. But dementia also can be solved by other diseases. So how we diagnose? Patient history take, family history, or we can do for EEG. It is not EKG, it is EEG. So also magnetic resonance imaging or CAT scan, we can diagnose by this. So treatment option in case of Alzheimer's disease, our target to increase the acetylcholine level, supporting care, right? So what are the specific medication we use? We use doneprazil, we use memantine, right? Most commonly used medication for dementia, sorry, for Alzheimer's disease.